This is Michael Smith from the Real Talk School of Nursing podcast. Nursing school is a struggle for many. Everyone struggles at one point or another, even that seemingly bulletproof student you're thinking about right now. Some people will struggle with tests, some will struggle with clinicals or lab or sims, and some of those students who struggle with none of those things will struggle within the profession. Nursing school is a struggle for some from day one until the day you graduate. It was for me. It might be for you too. But trust me, if I can make it, you can. Just keep working hard. Be truthful to yourself. Be joyful in the hard stuff. On the other end of school is a profession that is amazingly hard. I'm not going to lie to you, especially in the first year. And the rewards, though amazing, are sometimes heartbreaking too. You will have to wade through a lot of muck and mud to get to these amazing little jewels of experiences that make coming to work worth it. Nursing and nursing school isn't just about learning content, about learning the tasks that you have to do. It's about learning to grow through adversity, coming out the other end stronger. You will struggle outside of school too, but I promise you when you make it, it's worth it. So I'll see you on the other end of this crazy nursing school journey. Welcome to the Real Talk School of Nursing Podcast, Season 5, Episode 2. I am your good and faithful host, Michael Smith. Today, we celebrate CRNA Week by talking with Trevor Mueller, MSN CRNA. Trevor worked as a nurse in the cardiothoracic and surgical ICU. He teaches fundamentals of anesthesiology, airway management, ultrasound guidance, and is second in command at Klimek Reviews. And obviously, he's a CRNA. Can't wait to talk to him. Thanks for joining me. Let's jump right into it. All right. Well, Trevor, thanks for joining me. Can you kind of give me just a quick nickel tour of your career thus far? Tell me a little bit about yourself.
Yeah, Michael. I'm a certified registered nurse anesthetist, but I started off in undergraduate at Cedarville University studying engineering, and I thought I wanted to go into electrical engineering, and I did that for about a year and a half, and I got to a microprocessors class, and I hated it. And so I ended up thinking to myself, I want to work more with people than I do technology and computers. And my mom is a nurse anesthetist, and she was like, hey, I think you should maybe just shadow for a day. And so I went over like a Christmas break and shadowed, and I was like, wow, this is awesome. It's anesthesiology, nurse anesthesiology is an awesome mix of technology and connection with people. And so
Except
that's
when
when
they're out.
Yeah, exactly.
I mean...
there's a quality time, but not a quantity of time that you have with an awake patient. And so I ended up switching to nursing in the middle of my sophomore year, and then after I went through the nursing program there, I worked at the cardiothoracic and surgical ICU up at Case Medical Center in Cleveland, Ohio for a year. And then I went to the University of Cincinnati for their nurse anesthesiology program, and I was there for 2.5 years. And then I graduated and took my board exam to become a CRNA.
Mm-hmm.
And then I took a job here in the Dayton area of Ohio, and I was there for like 7 years practicing as a CRNA. And then I moved to Philadelphia and took some time, and actually was a full-time student studying at a seminary in Philadelphia, studying theology and the Bible, and it was a wonderful time there. I worked part-time as a nurse anesthetist, and then after 2 years of doing that, I came back to Dayton, Ohio. There's a church here we really like, and family isn't too far, and I like our anesthesia group here too. And so we came back here. I'm right back with the same anesthesia group, just practicing as a CRNA. So that's professionally, that's kind of where I'm at right now.
Ah, cool. So what is a CRNA? There's a lot of different pathways that you can go into in nursing. So like, what is that? What is it?
Yeah, so in the United States, there are a handful of different advanced practice nursing specialties. You've got midwives, you have nurse practitioners, and there's a bunch of different types of nurse
Yep.
practitioners.
Yep.
Then you have clinical nurse specialists, and then you have nurse anesthesiologists or nurse anesthetists. And the CRNA is the oldest advanced practice nursing specialty.
Mm-hmm.
We can trace our roots back to the Civil War, providing pain relief for soldiers in surgeries after battle, and then officially became organized as a group in the early 1900s, let's say, and our professional organization formed around then as well. And a nurse anesthetist in the United States is one of two types of anesthesia providers in the United States that can provide anesthesia independently.
Mm-hmm.
So in the United States, there are physician anesthesiologists
Yep.
and nurse anesthesiologists that practice anesthesia independently. Any other type of anesthesia provider is a subordinate provider that practices under somebody else. So nurse anesthetists enjoy a pretty broad scope within anesthesia practice and a lot of autonomy and lots of pharmacology and physiology. It's lots of cool hands-on skills, technical skills as well. So,
Sure.
Yep, that's a general idea of what a nurse anesthetist is in the pathway there.
So if you are a nursing student and you absolutely love pharmacology, like all nursing students do, you should definitely look into CRNA school.
Yeah, definitely. Yeah, because so many of them love it. And
it's like the bane of everybody's existence when they're going through nursing schools. Like, oh my god, I have pharmacology this week or this semester.
It's always a tough class, isn't it? It's always a tough class. You're right.
I wish that I would have earlier in that class had a better understanding of how to study for it, because there are so many nursing students who study it from like I have to learn each individual medication instead of learning them in groups. So that was a big help for me, is just like learning, hey, everything that ends with PRIL is a ACE inhibitor. Yeah. So, and it doesn't matter if it's Mueller Pril, Trevor Pril, or Michael Pril. It's still a Pril. It's still an ACE inhibitor. You're gonna be fine. Just learn that, and go from there. Is it? I'm guessing you get a little bit more in depth to be an anesthetist.
Yeah,
there's anesthesiology.
Yeah, it's funny, pharmacology, when you think of all the subjects that you took, it's unlike anything else, and,
Sure.
and you really haven't encountered anything else like it in your course of education, and so it definitely takes a different way to study for it. And but yeah, when you come into anesthesiology, it's just a new set of drugs that you just dig into a more chemical mechanism of action that maybe you just don't hit on in your nursing program, your undergraduate program. And so, yeah, you spend a lot of time on that more chemical mechanism of action and trying to learn that for your anesthesia drugs for sure, but then many other categories too.
Yeah. So you're like part pharmacy, part nurse.
Yeah, practicing pharmacologist, you could say. Yeah.
I tell you, our pharmacologists in the ER that I work at are just stupendous. Like their knowledge of drug interaction especially is just mind-blowing to me. I'm like, how do you know that? Like, how do you know how all this goes together? Like, that's so crazy. So can you tell me about I want to talk about CRNA school. When did you start thinking? I mean, so did you start out thinking that you were going to be an anesthetist when you did your initial licensure program?
So when I made that switch from engineering to nursing, and I shadowed and observed my mom, and of course, for many years, like I saw my mom's everyday life, and we talked about
Mm-hmm.
anesthesiology and being a nurse anesthesiologist. Just really, I saw that firsthand for many years. And I would read the professional magazines that she would get in the mail, and get the pens with the medicine from the med reps, and use them in school and stuff. And she would talk about it. But she never pushed me into it or anything like that. And so it was always in the back of my mind is like, hey, this mom's likes it, and
Mm-hmm.
it seems pretty cool. But then when I shadowed and saw, it was the combination of quality time with people, technical stuff, hands-on things, critical thinking that really appealed to me. And so when I saw that, I was like, I think I want to do this. That was right from the outset. So going into nursing for me was I wanted to pursue nurse anesthesiology.
Mm-hmm.
And but when I talked to a lot of my peers, they're like, oh, I didn't start that way. They never knew about it, or they happened across someone who was a nurse anesthetist who practiced in their hospital, or maybe someone in their community that they came and talked to them about it. So I would say there's probably 50-50 people who
Mm-hmm.
go into nursing and want to do it, and others who like happen into it and pursue it that way.
I had really thought about, like, that had been an initial interest of mine when I started, and then I got into that ER life, and they're like, yep, I'm good. I'm right where I'm supposed to be, I think.
Cool. Yeah, the ER is
Right
a good
in the,
place.
the middle of the chaos. That's for me. What is most people who are listening to the podcast have either already been through nursing school or are going through it right now, or are like doing their prereqs, and that can be very difficult. Like the initial licensure programs kind of they take their pound of flesh, so to speak. And the couple of CRNAs, or the couple of nurses that have been through school, kind of have something similar to say about CRNA school. Like, it's very tough, it's very demanding. It can be very hard on family life if you have a family. But can you kind of talk about like what school was like for that, as far as like what CRNA school was like?
Yeah, and it's gonna, whether you do nursing or any other, CRNA school is like nursing in the sense that it's very demanding. Expectations are high,
Mm-hmm.
and maybe the thing that's a little different is the type of people that tend to go into anesthesiology are pretty type A. Now, the nursing is like that in general, but these are people who are even more type A.
Like type AA.
Yeah, exactly. And so you'll feel that sort of tone at times in the operating theater, and in the program too. So the instructors will be more that way, and for some people that's like, oh wow, I love that, because they know exactly what to expect and they just move on. Whereas sometimes in nursing school, that you get some instructors or some areas of nursing that aren't like that, and it's more of like, well, I'm not sure, this is a gray area. And so when it came to CRNA school, for me, I went through as a single guy, and that's probably like the easiest way to get through school, I would say.
As a single person.
Yeah, you don't have family, no kid responsibilities, no spouse or significant other responsibilities. You're just taking care of yourself. And so you can just pour your life into the program, and that's true of nursing school too. You're probably going to have the easiest time if that's you. Now, that's not to say it can't be done. Just like nursing school, you can get through your anesthesia program if you have a family. My mom, in fact, she was a nurse for quite a while. And then she went back when my brother and I were, I would think I was 8 or 9 maybe, and my brother was 4.
Wow.
Yeah, and so she went back and she became a CRNA, after many years and had a family, and she did it successfully. And and my brother's actually a CRNA too. So the two of us, it didn't scar us, right? And there's a lot of things we admire about our mom in that regard, for how she did that and did it well,
I think
so you can do it.
That's a really important thing, because there in nursing school, when you have young parents especially, and I think in general more moms than young dads who are going through nursing school, like that question of like, am I a terrible parent because I'm in nursing school and I don't get to, I'm not with my kid at every moment of their home life, and that can be a hard question. But like that, hearing from you that from the child end of it, as you saw a parent go through CRNA school, that maybe the sacrifice was worth it.
Oh, definitely. And I would say so. And I think, when
you are scarred for life because you became a CRNA a CRNA as well, but but you made it through. You're not.
Yeah, and I think it does
permanently disfigured.
There is a certain amount of inspiration when you see your parent like working towards something like that and has that ambition and in that delayed grad. Maybe when you're a teenager or when you're a teenager or a young adult, you look back on your parent and maybe you didn't understand at the time, but you see the delayed gratification that they exhibited for a future benefit, and so you're like, oh wow, that's that kind of hits home and helps you take that same sort of approach that is really important to get through nursing school or graduate studies of any sort.
Yeah, crazy. That's pretty neat that like your mom's a CRNA and both you and your brother are too. That's pretty neat. Can you kind of dig into a little bit, like I don't want to get too down in the weeds about what what school was like, but can you kind of dig into it a little bit? Like, what was it like? What are the classes like? Where was your time? Where were the time demands? That kind of stuff.
Yeah. So here's what let me first talk about, like, kind of big overview now. So, like all advanced practice nursing is going towards doctoral degree for entrance into practice, meaning in a previous generation you had to have your master's degree to sit for a board exam, which would therefore enable you to practice in that advanced practice specialty.
Sure.
And so now all those 4, nurse specialist, clinical nurse specialist, midwife, nurse practitioner, CRNA, all of them are going towards doctoral degree for that. So nowadays, the program for a nurse anesthesia program, you're looking at 3 years, and you'll come out with your doctoral degree, which is a terminal clinical practice degree. So a DNP, or a Doctor of Nurse Anesthesia Practice, a DNAP, that's one that's unique for anesthesia. So I do not have that. When I went to school, I graduated from the University of Cincinnati in 2009. I graduated with a master's degree, and it was 2.5 years about. And so the way there's 2 different types of programs that are out there, and there's some that are front-loaded, where you do like the majority of your academics up front, and then you do all of your clinicals on the second half.
Mm-hmm.
Okay. The second type of program is an integrated program, where you'll do a chunk of academics up front, and then boom, they start getting you in the operating room, like maybe just 1 day a week while you're doing courses, and then over the course of time, your classes eventually will go down, and then your clinicals go up.
Mm-hmm.
And so there's advantages and disadvantages to both approaches. But my program was an integrated program.
Nice.
And so
I feel like that'd be like, there's a carrot there. You can be like, okay, like I get to see what I'm going to be doing at least a little bit while I'm doing it, to kind of keep keep your spirits up, so to speak. unless that clinical time is more like clinicals in nursing school, where another scarring experience within nursing school.
Yeah, no, the clinicals with anesthesia is always the thing you looked forward to, because then you could actually put into practice what you were learning in the classroom. And I know for me personally, that clinical actually helped me learn the classroom better and remember it. And now for some people that's not the case, but boy, I just needed that application to help cement the concept. And boy, how that's very true in your nursing programs as well. Like having that point of application is critical for cementing the concepts that you're learning.
Yeah, I that's how I am. Like I really need that. I really need that application part. Like there are so many things that I simply didn't get in nursing school. I learned it or whatever, but until you kind of see it in practice, see it in the application phase, in the ER. Like I was like, why? That's so simple. Why did that seem so hard?
Yeah.
When I was in school, like why is that? That could have been so much easier.
Yeah.
No, there's lots of stuff like that. Can you talk about and it can be a challenge that you faced in your initial program or in CRNA school, but since we're focused on CRNA, like can you talk about a challenging time or a challenge that you faced that while you are in school?
Yeah. So when you're in the program, the expectation from your instructors and leadership is you're pretty much putting 60 to 80 hours a week in for the duration of the program. So whether that's like of actual, you're in classroom, plus you're doing clinical, plus you're studying outside of class. Like you take those three things, that's your expectation that you're putting that kind of time in. And some programs even have you sign a statement saying that you will not work while in the program, and so they don't want you to work. So so that's a challenging thing. So like I lived on loans and some savings,
That's rough.
and so when you think about things that can happen, like I remember starting the program and like the transmission in my car went the second week that I started school.
Oh God.
You know what I mean? And you have to get up early. Like you have to get up early to get to the operating room for clinical stuff. So you're like getting up at like 4:00, get there by 5 because when you start things off, everything's slow, So like that's a challenge. But then I think maybe the thing that was the most challenging, I'd never learned how to study in undergraduate. And so in graduate school, I remember the first semester, basically in the first semester of my anesthesia program, we reviewed all of physiology, pharmacology, and chemistry that I had in my entire nursing program in the first semester. And so we would have an exam every single week on on each of those topics. And so in that first semester, you were just like reconsuming all the stuff that you learned, right? But you didn't remember very well or very clearly. And that was, I was like, how do you consume this? How do you even take this in?
Yeah, the volume.
And study it? How do you choose what is essential? And that's challenging. And so I think that's one of the big things, and that's probably true of any graduate program. Just the volume of information you're responsible for goes way up compared to nursing school.
Yeah.
And I think, so if you put those two things together, the financial piece for anesthesia specifically, you can't work. And then the second thing being just the volume of information you're responsible for and not knowing how to study. So to your listeners who are in nursing school now or maybe out of it and they're looking at graduate school, it would be really helpful for you to kind of nail down, how do I study, and try to come up with some good tools and methods for that before you start, and try to learn that in school, undergraduate, if you can.
Yeah. Like I answer the question all the time in some of my nurse groups, like, how do you read a textbook? Because you can't read it like a novel, and in a lot of textbooks as Mark Klimek says, there's the 3 N's, and most of the content in school is nuts to know. Like, this might show up in a this, that, or the other thing, and do you find that to be a CRNA, like, your level of expectation of depth is much greater?
Yeah. It definitely.
I wish you guys could see his face. Like, his face was like, huh, yeah.
Yep, it is. So, yeah, if we want to think about it in the terms that you mentioned, knowing Mark Klimek and how there's the need to know, the nice to know, and the nuts to know. It's absolutely essential that you know the need to know stuff in anesthesia program. You probably have to know the nice to know stuff for sure. And then the nuts to know stuff, if you want to get all A's in anesthesia school, you got to know all those. If you want to get B's, you're probably going to have to know about half of the nuts to know stuff. and in graduate school, the other thing about anesthesia school is B's are the minimum. Like, you cannot get through without getting a B. You have to. That's your minimum. So.
Yeah, my program was the same. I think we had like a 83 or an 85% standard.
Yeah,
and,
there you go.
There were a lot of times where I go through and I'm at the very end of the semester, and I'm right on the bubble.
Sweating.
I'm right on the bubble, and thank God I was not the only one who was in that position more than once. I'm really looking at starting this whole thing over again. I'm 5-10 points away or something like that. That can be really. How did your first year? So let's talk about actually working as an anesthetist. Like, what was the first year of CRNA, your CRNA experience like, versus like what your first year as a new grad was like? Is there some similarity?
Yeah, that's an awesome question. Okay, because there's a lot of comparison or contrast that we can make here. So if I think back to my own undergraduate nursing experience, and probably 99% of the people out there that are listening, when you go through your clinical experience, you're going to get out, find your job, and when you get your job, there's going to be an orientation period where they're going to like help you hone your knowledge in and really do a good job. And so there's still a lot for you to learn when you graduate as a nurse here in the United States. And
I say all the time, like, when you pass the Nclex, that's the day that you're going to discover that your education is ahead of you instead of behind you. Like, there's so much learning that has to happen in orientation. Yeah, for sure.
So undergraduate nursing programs, prepare you to be a safe generalist. And then you're going to jump into, like you, Michael, you jumped into, emergency care, and now you're like honed in on there, and you're good at that, right? So that was what your preparation, what your clinicals prepared you to do when you exited your nursing program. Anesthesia school is different. For nurse anesthesiology, there's the amount of clinicals that you put in that time period is it's so high. It dwarfs the amount of clinical time you get as an undergraduate nursing student in your nursing program. Yeah. So the expectation, and this is why nurse anesthesiologists are capable of practicing independently, are one of the 2 types of providers that practice independently. The expectation is that when you exit school, you are a safe provider that can practice independently. And so your education and training has to be commensurate with that.
Yeah.
And so when you exit and you pass your board examination saying that you're safe, it's not to say that you don't have more to learn, because there is tons to learn. But you can you should be able to step into an operating room on day 1 and take care of things, aside from like, hey, logistics, like, what do you use for charting, or you use this pump versus this pump, that kind of stuff. And so But employers expect you, like, pretty much first day, get going. There's not any orientation period with like somebody else being there with you, helping you through things, other than maybe logistics. All other clinical decision making, you're expected day one to rock it out.
That's a lot of responsibility. That is a lot of responsibility. So can we let's take a quick break right here. We've been going for about a half an hour. Yeah, why don't we do that? Let's take a quick break, and then when we come back, let's talk about a little bit more of school, a little bit more motivation, and like how students can kind of navigate their desire to be a CNA. Our sponsor for this segment is Bergman Grossman's Day-Old Countryside Open Air Fish Market. You know, we're all strapped for cash, so why spend your hard-earned money on fresh fish when you can spend less money on a slightly older fish? Let's be honest. Is a day-old fish sitting in the sun in the geometric center of the United States really that much different from fresh fish that's sold at oceanside markets? Some of the fish might be slightly older than a day, but that just means it's discounted even more. Cook it over a campfire and you'll never be able to tell the difference between necrosis and good old campfire char. So go down to Birchman & Grossman's Day-Old Countryside Open Air Fish Market right across from the Sunset Motel and RV Park in Belfouche. Mention the Real Talk School of Nursing podcast for a free basket of raw crustaceans. Take them fresh or ship them anywhere in the lower 48 via the U.S. Postal Service for their $8 special 6-day guaranteed delivery service. So stop down at Birchman Grossman's Day-Old Countryside Open Air Fish Markets in downtown Belfouche, or stop by for the grand opening of their second location, Birchman Grossman's 2-day-old Countryside Open Air Fish Market just off Highway 85 in Jolly Dump. Pasture parking and porta-johns are available for all paying customers. BYOTP, or bring your own toilet paper. Birchman Grossman's Day-Old Countryside Open Air Fish Market. If you think the name is a mouthful, wait till you try the fish. All right, Trevor, welcome back. Thanks for sticking with us. Let's talk about maybe some of the initial motivation. So, like, I see all kinds of young students, and some of them haven't even started nursing school yet, who have this, I'm going to be a CRNA kind of narrative, and maybe they didn't have that same mentorship that you had.
Yeah.
But they have this kind of, that I'm going to be a CRNA kind of narrative whenever they start talking about nursing school. And while I can understand wanting to lay out goals, this is kind of the direction I'm heading. After I've had some experience, I still feel like, me personally, like I still feel like I haven't seen enough to really know what I want to do.
Yeah.
The ER's the right place for me, but I still feel, even like after 2 years, like I don't have enough experience, even within the ER, even within my own area of expertise, if I can use that term, for 2 years of experience, call it expertise, to really determine where my goal set should be. So my question is, for someone who's at a high volume, high acuity hospital, what are the right set of experiences that I should, or an aspiring nurse should have before they really should consider having or going after a higher degree, like a DNP, or in this case a CRNA?
All right, that's a good question. So what we'll do, I'll talk about it like generally, and then maybe hone in on nurse anesthesiology a bit there, okay?
Okay.
So let's say you're an undergraduate student. I think that what you should do as an undergraduate student, if you say to yourself, man, I really have no idea where I want to end up within nursing, but I know I'm going to be in nursing. Okay. Focus on Each just focus on doing the best you can at growing at all the nursing stuff you do, your assessment, your diagnosis, evaluation, your planning of care, that kind of stuff, mastering, your pharmacology, your physiologies, trying to connect those with as many of your clinical experiences that you can. When you get out of your undergraduate program and you get your first job, find a job where you're gonna have potential to be mentored, and you'll have a good setup there. That's good. If you can get a residency or a mentorship program or orientation where you have some input from some experienced nurses, that's really going to help you be successful at not just that job, but your next one too.
Mm-hmm.
And then eventually what's going to happen is whatever job you're in, you're either going to like it and, kind of grow in that, and or you're going to be like, man, this is not for me. And if it's not for you, then you'll probably run into other people in your circles within your facility that do other things. And so I would say, take a day or part of a day, half a day, let's say, 4 hours maybe even, and just shadow or observe someone in a different role. And that's really going to help you see, all right, could I envision myself doing this? And if you can do that in nursing, and then if you're even curious about any of those 4 advanced practice specialties I mentioned, you definitely have to go shadow. In fact, for all of them, I'm pretty sure that for the application process, you have to say that you shadowed somewhere and have that person that you shadowed actually sign the form when you put applications into programs for not just nurse anesthesiology, but also midwifery and nurse practitioner and CNS. So that's a really important piece to help you kind of figure out, well, what am I interested in? And then some of it is you have to do an inventory of yourself, If you're someone who's really likes, as you mentioned, the pharmacology, maybe some of the harder sides of the sciences, and then maybe think more along the lines of like your ICUs and those kind of critical care areas, and maybe even ER as well, depending on that setting. But if you're someone who's maybe on more of the soft side, and there's more subjectiveness to the judgments you're making, then maybe you're thinking more of like mental health, or maybe even in the community at a public health sort of level. So those are things that you can do, or maybe even like more of a social aspect to the nursing that you can do and pursue. And you'll have to investigate those and just think about yourself, and check things out, do some observation, and if you try it, at least you can eliminate it. That's what I'd say in general.
You have to. I think that's a invest. You're gonna have to invest some time in yourself to make sure that whatever pathway you do, like this is not going to happen during school hours or during work hours. Like you're gonna have to investigate. You're gonna have to invest some time.
Mm-hmm.
Okay.
So
specifically about CRNA school, what are those sets of experiences that would be ideal in your mind?
Yep.
For someone who was looking at that.
Yeah, so if you're an undergraduate nursing student and you're like, man, I know for sure that I want to pursue nurse anesthesiology, what I would say is the first thing you need to keep that as a goal in ahead, but the first thing you need to pursue is positioning yourself to get a job in the ICU right out of school. Okay, and then once you get that job in the ICU right out of school, focus on becoming the best ICU nurse you can possibly be in the time that you're there. And so if you are a nurse and you are already if you're a nurse and you want to go into anesthesia and you're not in the ICU, you've got to focus on getting into the ICU and being an awesome ICU nurse and learning as much as you can. Take care of the sickest patients, work some extra shifts to save some money, and learn maybe about new patients that you've never taken care of before, manage different drips, manage different ventilator settings, and so on. That'll be critical to your preparation. And then if you are already in the ICU and you want to pursue anesthesiology, then you just have to do the legwork of looking at all the different programs, talk to students in those programs or people who've graduated from those, and
Yeah,
see what,
definitely.
because some of those programs like maybe have some unique things that will set applicants apart from the mass of pool, and that can be really helpful.
Yeah, I have often encouraged people who are looking at trying to decide like which, they're done with their prereqs, for example, and they're looking at at nursing schools and doing their application and stuff like that. Like talking to people who are in the program currently is so valuable. I think it's like I think that's one of the things that's really missing for prereq students specifically, is the ability to connect with students who are in the program right now. I think that would be so valuable, valuable. It's kind of a joke, like every especially like the CV ICU nurses. It's almost a meme. They're like, so why did you become a CVICU nurse? Like, oh, so I could go to CRNA school. Like, it's like almost becoming a tech in my ER is like, well, why are you a tech? Like, so I can be a nurse. Like, that's the intermediate step there, but not one that you can skip over very easily. I think. No, I think I think you make a really good point. Is that seeing I can see how managing drips and managing your ventilator settings and kind of being an expert in on that would be extremely helpful for you as an anesthetist. I think that I can see where that's valuable.
Yeah.
especially from the ER standpoint, where I feel like I'm the village idiot of nurses, because we just have to be so broad. And it's weird because you have to be so broad and yet so specific in our knowledge. Be like for especially like trauma and those that critical initial stage of care, I think is a really specific skill set. And I'm jealous of some of my my ICU friends, and especially the nurses, the float nurses who can go between ICU and ER. Those are the nurses that I really like to talk to, because they are so smart in such an amazing. Oh gosh, like one guy in particular. I'm actually, now that I'm thinking about it, our critical care or resource nurses they're like the highest trained, like the most experienced nurses in both. So if you think of the ICU, if you're in an ICU and you think of the smartest ICU nurse there, these people are like better than that.
Wow.
And if I think of like the best ER nurse that I know, they're better than that. And we have 2 resource nurses on staff at the same time. So like if things are going badly in the ICU, they come down to the ICU, and if things are going badly in the ER, they come down to the ER to help. And that's those nurses. Those are the ones that I really like to be plugged in with.
Yeah, that sounds like a flight. That sounds like a flight nurse in a lot of ways, right?
Yeah. They're so smart. They're so smart.
Another. This is just a quick thing, that whether you're interested in pursuing nurse anesthesiology or one of the other advanced practice specialties, it's important to get experience, I think. But here's the thing: I don't think you need to become a master at being an ICU nurse before you move on to become a nurse, into a nurse anesthesiology program. And the same thing for any of the other advanced practice. You don't have to become a master and like know everything. Is it going to help you? Sure, it would later on, but I think that's something that a lot of people say, like, oh, gee, I haven't even got I've only been here for a few years. There's so many things I don't know. I'm not going to move on until I know everything. Well, you're never going to know everything.
I feel that way.
Yeah, you're never going to know everything. And so if your ambition is to move on to a role where you're going to have a broader scope of practice, more autonomy, then, learn some really important stuff, but then pursue it. So don't feel paralyzed by not having a mastery of everything at your current state. So.
Interesting. That's a good tip. So what is it? Can you kind of talk about what it's actually like working as a CRNA a little bit?
Yeah. So nurse anesthesiologists, we care for patients in a bunch of different settings. I'll name a few.
Okay.
The easiest one that everybody knows is the operating room. Okay, so putting people under general anesthesia, maybe sedation. That's an easy one. Another one is in the obstetrics. So patients having babies, so putting epidurals in, doing spinals for C-sections. Some other things that we do are chronic pain intervention. So patients with chronic pain can go and get injections and get thorough pain evaluations by CRNAs that have fellowship training in that. Regional anesthesia for acute pain. So providing nerve blocks for different areas of the body so that patients don't have to take as many narcotics and they can go home with their pain controlled. Those are just some of the areas, and there's a few others. Here's one. Running ketamine clinics for patients suffering from things like PTSD or intractable depression, that kind of stuff. So there's a lot of different areas that we can work in, and
I hadn't even thought about all those. That's crazy.
Yeah. Pre-admission testing clinics. So patients who are scheduled for surgery come in ahead of time, and a CRNA can see them, assess them, evaluate them, refer them for like cardiology, for echocardiography and scans of their heart or pulmonary function testing and so on, so that they're optimized when they come for surgery to decrease their risk for any intra or perioperative morbidity problems. And so we're really critical and really valuable there. Most recently in the coronavirus pandemic here, right, where a lot of nurse anesthetists transitioned to the ICUs and help manage all the ventilators, perform line insertion for central lines, arterial lines, extra IVs. They led the proning teams oftentimes. All of that kind of stuff. Manage help
tummy time.
Yeah, help with the drips. So like an intensivist role, if you will. So.
Oh, okay.
So those are just some of the different things that CRNAs can do in our scope of practice. But let's just take the easiest one, the operating room. I come in the morning to the operating room about 6:30. I look at my cases for the day. I set my cases up for the day in my operating room, check my anesthesia machine, get all my drugs drawn up for my first patient. I review all the things on my first patient's history. I go and I meet them. And I may put an IV in, draw labs for them, review any questions they have, explain my plan for them. If I'm going to do any regional anesthesia, putting numbing medication in any parts of their body to help relieve their pain for the surgery, I might do it ahead of time. I might do it after the fact. It all depends on the flow of things and what I want to do for the surgery that day. And then I'll take the patient back to the operating room when it's time, put them off to sleep, put any breathing devices in their throat. They'll do the surgery, then I wake them up, take them to the recovery area, report off to the PACU nurse, and then just keep doing that same thing with all my patients during the day.
Are you you're on the side where everything's a little bit more planned, so you're OR? Is that the area that you're in?
Yeah, I do OR. I do OR and OB, and I do a lot of regional anesthesia too. Yep.
Okay. So, are there CRNAs that are involved in like trauma as well?
So when it comes to trauma, it would be the kind of thing where like you have staffing for like regular elective surgeries in the operating room every day.
Yeah, because you were talking about your caseload and stuff like that. Like you're reviewing your cases for the day or whatever. Like, are there other CRNAs or anesthetists who are involved more on the trauma side? So, like, we don't know what's going to come in today, like that kind of stuff. Does that get put onto your caseload, or are there specific CRNAs or anesthetists who handle just the trauma stuff, the unknowns?
In general, every CRNA should be able to handle that, so that in the event that, like, hey, we have an emergency coming, we're going to stop elective cases in this room and we're going to delay them so that we can handle this trauma. However, usually, like in the staffing models of like the level 1 or level 2 trauma centers, they may reserve an operating room just for trauma that comes in at any moment and have someone available, so that if a trauma comes in, they already have staff available and that can take care of that patient.
So you don't have stuff where your effort or your day is diverted by a trauma or something that comes in. Like
there may be emergency cases. Yeah, there may be emergency cases that come in and would bump your normal surgery schedule, and that's just something that happens sometimes. Okay. But it would happen more frequently in like a level 1 trauma center.
Sure. Okay. If I wanted to learn more about nurse anesthetists, where would I go?
The best place would be to go to our professional organization, which is called the American Association of Nurse Anesthetists, and their website is www.aana.com. And then here's the second thing I would encourage is this. I would listen to some anesthesia podcasts by some CRNAs.
I do love podcasts.
You do, Michael, yeah. And you have a good one. And so there are some anesthesia podcasts, and I'll leave some notes with which ones those are for you. You can put on your website or, in the comments, however you want to do that. But there are 2 in particular run by CRNAs that are excellent introductions for anybody that want to find out more about clinical things, pharmacology, new developments, the politics. There's a lot of politics in anesthesia, or new developments and that kind of stuff. So podcasts are a great place for that.
And part of the reason, or like one of the reasons that you and I connect, is because you work in your off time, in your spare time. You work with Klimek Reviews and Mark Klimek. Can you kind of tell me, like, what's your role with Klimek Reviews?
Yes, so Mark Klimek was one of my professors at Cedarville as an undergraduate nursing student, and then I reconnected with him in about 2014, and he asked me to come teach his review course, which I gladly did. And since then,
that'd be pretty neat.
Yeah, since then, he's added a few other instructors, and that prior to coronavirus, we were teaching in a bunch of different areas of the country. I was in New York City, teaching a lot in New York City, and then we were down in Florida and Texas and California, to name a few, and Virginia. And so, in addition to Mark in Ohio and Kentucky. But my role, in addition to being an instructor with Klimek Reviews, is I really oversee a lot of the social media, and I helped really develop the Blue Book web app that we have that helps students master essential content for the Nclex. And Mark and I talk monthly, and we kind of plot out what's going to happen over the course of the next year. And when things like coronavirus come, we think, man, how can we reach these students and get them the tools they need to be equipped to pass the Nclex? Because, man, our country needs competent, safe nurses, and so we want to be able to keep doing that and helping students. So that's really what my duties are with him.
What like I kind of imagined, because throughout the pandemic, it seemed like the brakes were kind of slammed on for Klimek Reviews. Like a lot of the reviews went away, and I imagine that you guys were somewhat busy, like the rest of us who are working. So that's part of it, I think. But I've seen the online reviews kind of kind of coming on, and I really like the idea of the online reviews. How have those been going?
We have students that really enjoy it, and we found that they
Mm-hmm.
like it, and we're pretty devoted to our in-person reviews because there's a lot of
Yeah,
dynamic that happens between the
I agree.
instructor and just being available right there in person. That being said, the online reviews are very, very effective. And we've had notes from a lot of students that they've been successful and they fill up really quickly. And I think that it
Mm-hmm.
really helps us reach a lot of students who otherwise wouldn't be able to come. And so we want to keep doing them. But one of the things about our instructors, all of us as instructors actually work as nurses in some
Yeah.
capacity, which isn't true of many other review courses. You have people who are just professional instructors, if you will, and there's not always this connection with the real life and helping students see that. So that is a challenge for us, but I hope that the fact that we all are working in our profession really gives us an edge and a way to identify with students that are preparing for the Nclex that other places don't.
I really appreciate, or one of the things that I really appreciate about how Mark breaks down the knowledge. It's not just the book knowledge stuff. He approaches it from that application part. Like I the um, the electrolytes stuff that he does, absolutely mind-blowingly easy, and that's something that I still use like today. Like I still think about those things in those terms. Like, okay, what am I seeing in the patient? Well, I see these kinds of things. Like, okay, well, they have a history of hyperkalemia and stuff like that, and I'm seeing these symptoms. Like, okay, I'm expecting this now, or those are one of the things that I like. All right, well, I know that I'm going to be looking for a like a potassium level on this patient, and or magnesium level on the patient, and like I understand that, or I start looking at when one of my providers puts in an order for magnesium specifically. I'm like, why is this? What should I be looking for in that? The way that Klimek Reviews breaks that down, I think, is just so smart. It's so it's so nice. It's so nice. Um, and again, like I don't get anything from Klimek Reviews, so this is all organic and organic praise. But highly like I cannot recommend you guys enough. Um, so I see that there's a live review coming up in Ohio and California next month. Is that right? How like I imagine that those things filled up again pretty quickly. Is there a plan for more live reviews as they come up?
Yeah, so one of the big challenges is a lot of our venues, in order to accommodate people during the gathering restrictions,
Mm-hmm.
the room size, they have to social distance people. So we can accommodate, like, depending on where we're at, like half to one third the number of people that we otherwise usually would have accommodated.
Mm.
And so they haven't closed us down for any reason, which is great. But we can only have like one third of the people there that normally we would have because everybody's social distance, which is good because, gee, it makes it easier maybe to connect with people individually potentially.
Mm-hmm.
But it's hard because we sell out really quickly because there's
Yeah.
only a few tickets, and everybody wants to come, and so that's the challenges
And
that
if
come
you
with
don't,
it.
you should.
Yeah.
Um, is there do you guys have something in the plans where you're both doing the online part? So like it's you're taking one of your live reviews and people can log in to see that. Like is that something that's coming up, or is that a thing? Is
So
that even
right now
possible?
the plan is to as gathering restrictions lift, should the government authorities and leadership allow that to happen, would be to get back to our in-person reviews and just ramp those up as that allows. But we are going to have regular online reviews and offer those to students. As far as like live online, as far as having a recorded online review, we don't have plans to do that, because we do want to have this ability to tailor a review to the audience, the people that are there, which even in our online reviews, we can get that immediate feedback and address it right there. And maybe we need to linger on one place or emphasize some different examples to communicate the idea, versus, in a recorded format, it's just, well, here it is. And we can't really tailor it, because every group's a little different, especially when you have an online review. People are coming from all over the country, and you want to do it justice and do the best you can for the students in that way.
That's awesome. Where should, what's the best way to connect with you, Klimek Reviews? What are some other resources that people should be looking at for CRNA, stuff like that? You talked about podcasts. One of the ones you talked about was The Head of the Bed, and another one was Anesthesia Deconstructed.
Yes.
And we don't have to go into into those specifically, but I did want to bring them up because you brought them up.
Yeah.
But those two specifically you talked about are actual anesthetists who are talking about it.
Yeah, they're both run by CRNAs, and there's a nice repository that you could even start backwards and kind of listen from the beginning. And they're going to give you insight into what nurse anesthesiology is like. So if you're someone who's even the remote, just a little bit intrigued by nurse anesthesiology, listen to those on your car ride. Just listen, see what you think. If you're an undergraduate nursing student, instead of whatever you do for fun, on your fun podcast, maybe you turn one of those on just to see if it piques your interest. And then maybe the next step you take is to actually shadow a CRNA. So, those are the kind of steps you can take with those sort of things. When it comes to Klimek Reviews, the best way to connect with us and to see what we are offering is just to go to our website, klimekreviews.com. And then we have a few different things to offer. We have the live in-person and live online reviews. We have the Blue Book web app, which is an app that identifies the essential information to pass the Nclex. And it's basically a series of questions and answers. It's not an Nclex style question format, because you need to master essential content for the Nclex, and Nclex style questions don't help you do that. You need to have this Blue Book question answer format to help you do that. And then the third thing that we offer, and this is really cool, a lot of people like this, is if you need help applying knowledge to Nclex style questions, Mark Klimek actually hosts online, live, small group tutoring sessions where he goes through Nclex style questions with a small group of people, and he'll help you think through them and answer your questions. I think they're a few hours long, and so you can pay for that and sign up for that as well. Those are the three things. Yeah.
I want to be conscious of your time here, so we'll just kind of end. Can you share a story, or can you share some kind of experience that you had that like one of those good experiences that kind of help keep you going, or if you're having a good experience like that, like the first thing that comes to your mind working as a CRNA?
So there was a woman, this was probably in the summer. There was a woman who came in, and she was having mastectomies due to cancer. And one of the things that we can offer patients is a nerve block we put in her back, and I was able to use that nerve block, and I put it in ahead of time in the preoperative area. We talked through everything. Very kind woman, full of grace, and she was probably in her 50s, mid 50s, and very scared, and had a lot of worries and anxieties over the procedure, of course, but she was very scared about the pain afterwards. So I talked to her about this nerve block. I performed the nerve block, and then we went back for the surgery, and they performed the mastectomies, bilateral. And one of the big things with nerve blocks is eliminating narcotic from people's perioperative experience because of the nausea that it sometimes causes, the disorientation, the constipation, all that kind of stuff. So this woman also had some history of nausea after anesthesia. So between that nerve block and the type of anesthesia I used, I didn't have to use any narcotic for her bilateral mastectomy.
That's amazing.
Yeah, and she came out of this surgery and her pain was really, really low, like a 1 or a 2. And, I look back and there's a lot of people who invested in me to enable me to do those kind of nerve blocks. And this woman's concerns, the pain after the surgery, the nausea after the surgery, I was really able to take those risks down considerably. And then another piece, so that's like the clinical end of things and how to care for a patient that sticks with me when I didn't have to do the nerve blocks, right? I could have just gone with the same, good old narcotic to help her. But it took extra time, but it was best for her. And there's going to be a million other things like that for you as, no matter what area of nursing you're in. We're taking the extra time to sometimes do the stuff that it's a lot of work, and it takes a lot of work to get to the place where you're proficient at something,
Mm-hmm.
And so
sure.
You got to invest in the time to become proficient at it. You have to have good mentors. And so when it comes time and you are proficient, use it to help the patient, even if it takes the extra time. And then secondly, when there's someone else that comes along who's a novice, teach them. Take the time to teach them. Remember that you too were a learner, and encourage them and teach them, and so they have the tools to take great care of patients. And for a lot of your learners or your listeners who are in the nursing programs right now, it's hard work. Stick with it, though. You're getting the tools you need to really, once you enter your nursing career, to help people, and our country needs it, and needs excellent, safe nurses. So keep your eyes on down the road and work hard at what you're doing at right now.
Awesome. Trevor, thank you so much for joining me. I really appreciate your time and taking time. What day is it today? The typical overnight nurse. I'm like, I don't even know what day it is today. But yeah, it's Saturday. So thank you so much for taking some time. Congratulations also. You guys just had a baby.
That's right. Yeah. Praise God. Thank you so much for that. Yeah.
Yeah, that's amazing. Everybody's doing good.
Yeah.
Baby and mom is doing good.
Yeah, baby's well, mother's well, and they're doing well, and the rest of the house is adjusting. Just sleep deprived, right? Sleep deprived. So, but you've been a great
other kids
host.
are handling it okay.
They're handling
awesome.
it well. You've been a great host, Michael. So thanks for having me, and hopefully here in the spring I can come back and we can talk a little bit more about hopefully updates or things that are going on with Klimek Reviews too.
Awesome. Thank you so much for your time. Bye, Trevor.
See you, Michael.
Sponsoring this segment of the Real Talk School of Nursing podcast is Mike and Bonnie's Snow Shovel and Driveway Salt Emporium. When the temperature drops fast and rain turns to ice in your driveway, which is then covered by 6 inches of snow, you need 2 things: snow shovels and driveway salt. Luckily, there's one place you can get both of those things. They have everything. They have all of your favorite trenchers, cleanouts, border spades, cap rocks, post hole diggers, grain scoops, and hand trowels. That's right. Everyone from the toddler in a sandbox to the fashionable urbanite and the sun-hardened farmer. Mike and Bonnie's Snow Shovel and Driveway Salt Emporium can cover all of your scooping, transferring, farming, digging, and shoveling needs. So, stop by Mike and Bonnie's Snow Shovel and Driveway Salt Emporium off Route 44, where the only thing that's deeper than the holes you can dig with their great shovels is their discounts. Bring your receipt from Nick's Horseless Diner and get an extra 5% off of your purchase. Oh, wait, this just in from Stuffy's, where all the food is served by waiters and waitresses on horseback, that if you bring your hoofprint marked placemats, you can get an extra 10% off of your purchase. I asked if this was in addition to the 10% you get off for being a Real Talk School of Nursing podcast listener, and all I got in response was... I'm not entirely sure what that means, so let's get back to the show. This Real Talk School of Nursing podcast is a Real Talk production. This podcast is dedicated to our brothers and sisters on the front lines of this COVID-19 situation.
Sic semper tyrannis, facta non verba.
Good night, Steve Cannon, wherever you are. Annyeong Kasayo. Now you go home. Thanks for listening. You can support the show directly on our Patreon account at www.patreon.com/realtalknursing and gain benefits such as early content, shoutouts, and special swag. Write into the show at realtalknursing@gmail.com or use Facebook, Twitter, or Instagram at Real Talk Nursing. Thank you for supporting our friends, affiliates, and sponsors and following us all on social media. More listeners, likes, and followers means more and better shows. Make sure to share the episode with classmates and give a hand up to those who are coming behind us. Don't forget to reach out and tell us if you have any announcements or special shout-outs to friends, classmates, or colleagues. If you like the show, the Real Talk School of Nursing podcast is available everywhere, so go to wherever you download podcasts, subscribe, rate us, review us, write into the show, and smash that subscribe button. Remember to leave only 5-star reviews because that's the only ratings that count to get us noticed by more nursing students. We want you to be part of this crazy nursing school journey. The Real Talk School of Nursing podcast is a holy moly, I can't believe you're still listening to this podcast.